In today's presentation, the 8th since the beginning of the fall semester, I wish to focus on the efforts of our researchers to respond to the pandemic and study the virus SARS-CoV-2, which is responsible for causing COVID-19. Across our university in a range of fields and disciplines, our faculty are contributing their knowledge and their expertise to the pandemic response. This presentation will address the work of our faculty at our medical center, who are working on understanding both the virus and the disease, and those whose research and expertise is helping communities around our world respond to the pandemic. In any given year, our medical center researchers conduct more than $100 million in sponsored research. When the COVID-19 pandemic hit, our researchers were asked to pause all research that was non-essential as our community transitioned into a virtual learning and teleworking environment. Realizing the contributions that our scientists and researchers could make to understanding this novel coronavirus, we asked our colleagues to imagine new research projects or expanding existing projects. Our colleagues immediately began to develop new research plans in order to apply their knowledge, expertise, and laboratory teams to the COVID-19 response. In recent months, more than 15 research teams have launched projects to accelerate and expand COVID-19 research. In addition, colleagues have been engaged in work to support policymakers and government leaders in making informed, evidence-based decisions. At our medical center, 11 different projects have received funding from extramural funding agencies, and some have received industry funding for clinical trials. Let me share with you some of this work.
Translational immunology with a focus on transplant immunology as well as on oncology.
To develop biomarkers that can predict who's going to do well and who's not going to do well.
Radiotherapy can affect anti-tumor immunity and how we can...
wanted to know is what the exposure rate is for our hospital workers.
The antisense of the positive strand of RNA that's in the virus, and we attack it.
To understand how the oncogenic virus causes the cancer, basically is converted to normal cell.
We can test in parallel up to 1,000 conditions at a time to see how it alters the cell's behavior.
Doing data mining from kind of large cohort analyses to figure where we can kind of provide answers to kind of clinically challenging or clinically unanswered questions.
And prediction of chemical or drug interactions with a wide variety of proteins.
Angiotensin converting enzyme 2, and ACE2 is the target that the virus uses to enter cells in the lungs.
One of the pathways that we study for inflammation may be activated actually by COVID-19 virus.
During the COVID crisis, we have a chipset that we use for this type of protocols on Parkinson and whatnot.
This particular virus, we had an idea, may actually affect the brain based on findings.
Let's see if we can develop a radioligand and we could use it to screen for drugs that are already on the market for potential repurposing.
The advantage of Georgetown is that because there's, I think, the natural interaction between scientists and the clinicians already in place, we're pretty easily able to now switch this kind of mindset towards treating COVID-2. Because really that's really everyone's focus right now. That's all we're doing.
They are coordinating very quickly with a clinical team. They actually encourage those rapid response from our scientists.
There are a lot of interested people who can easily adapt their research into COVID-19.
People who devoted their lives to sort of taking on healthcare challenges wanted to have a chance to participate in trying to make a difference in this arena?
Honestly, I'm very energized. The privilege that I have is that I'm not only serving patients on a daily basis like today, and I'm actively treating COVID patients, but that it also can make a contribution on the scientific side.
I think that being a Jesuit institution and our values and make it a perfect place to try to attack this COVID-19 pandemic.
And people come to me for all kinds of collaborations. And that's how it works. That's how it works.
I think it's also a very important message for the DC community to understand that an academic institution like Georgetown has these researchers here who are trying to contribute to solving the problem.
The relationships that are in place, the ability to work with each other in place, and really the emphasis that's coming from the leadership to work as teams.
They've really been a sounding board that I've been able to kind of bounce ideas off of and make collaborations in order to continue not only my individual project, but some of the other projects that I have interest in.
The people I work with are so gifted and have such great ideas. And I just love the fact that, you know, I can be included in the Georgetown community of researchers.
And I have the perfect group of collaborators, and Georgetown is it. It's the place.
I wish to turn to a few specific projects which are developing new approaches to treatment and prevention. A decade ago, the National Institutes of Health, the NIH, awarded Georgetown a Clinical and Translational Science Award. With this grant, we have been able to partner with Howard University to create the Georgetown Howard University's Center for Clinical and Translational Science. Translational science, taking basic research findings and translating them into clinical applications through clinical trials. Recently, our center has been actively engaged in research to prevent and treat COVID-19 and have launched 2 clinical trials, one focused on the prevention of COVID-19 infections using convalescent plasma donated from those who have recovered from the illness, and one focusing on the treatment of COVID-19 using monoclonal antibodies, substitute antibodies that are created in a laboratory to support the immune system. The convalescent plasma study is being done in collaboration with Johns Hopkins University. Dr. Sebla Kasai, an infectious disease expert, is Georgetown's lead researcher on the project. She recently shared her perspectives on this work.
My name is Sebla Kasai. I'm an associate professor of medicine in the Division of Infectious Diseases here at Georgetown University. My colleagues and I have been taking care of patients with COVID-19 disease since the start of the pandemic. It quickly became apparent to us that this infection is like nothing else we've seen before, and it's very hard for us to predict who will get very sick and succumb to this disease, who will recover. And of those who do recover, there is a significant portion who have ongoing symptoms that affects the quality of their lives beyond the time of initial recovery from this disease. We are engaged in various studies involving COVID-19, and one of those focuses on trying to prevent COVID-19 disease using convalescent plasma. Convalescent plasma is plasma that has been donated by people who have recovered from COVID-19 disease. We are using plasma that has high levels of antibody that are measured, and we are using it in the setting where people have a high-risk exposure, either in a household, community, or work environment in the recent few days preceding enrollment into our study. The premise is that antibody that's present in this plasma could provide protection and either completely mitigate disease so the person does not become infected, or if they do become infected despite having the antibody given to them, that it will decrease the severity of their illness such that they will not require hospitalization or have long-term consequences to their illness. We are doing this in collaboration with Johns Hopkins University, who designed this trial, and we were given the opportunity to participate through the Trials Innovation Network of the Clinical and Translational Sciences Award collaboration, of which Georgetown University is a member. If this approach is successful, it could be a very important adjunct to any other prevention modalities, including vaccines or natural infection, especially as we don't know whether there'll be durable antibody or protective response to either natural infection or vaccination. This pandemic has really created a situation for us where everybody has had to step up. As physicians, scientists, we are relegated to using the scientific method, an approach that we have all been trained in to identify ways to mitigate disease and to promote community health. But everybody else also has a part to play in preventing ongoing transmission of this virus.
This year, our Georgetown Lombardi Comprehensive Cancer Center is celebrating its 50th anniversary. Among the first centers to be designated as a comprehensive cancer center by the National Cancer Institute, it is the only cancer center with this designation in the District of Columbia. In collaboration with our partner, MedStar Georgetown University Hospital, Georgetown Lombardi has begun a study to test for specific virus antibodies in both people with cancer who are vulnerable to COVID-19 and in hospital workers. Within just a few weeks, the study had collected specimens from 400 patients and 1,000 hospital workers. Dr. Michael Atkins is a medical oncologist and lead investigator of the study.
Good day. I am Dr. Michael Atkins, and I'd like to talk to you about our COVID-19 research project. In April and May, during the height of the first wave of the pandemic in DC, we conducted an investigator-initiated study to analyze serum for antibodies to SARS-CoV-2 in hospital workers and patients with cancer at MedStar Georgetown University Hospital. Antibody results were linked to a detailed questionnaire about recent symptoms and chronic health conditions, and for hospital workers, job description and extent of COVID-19 exposure. For cancer patients, their EMRs were reviewed by Georgetown medical students to identify their cancer and treatment types. Lead investigators also included Drs. Katie Lai, Lisa Boyle, and Arnie Petoskey, and efforts were supported by the Survey Recruitment and Biospecimen and the Tissue Culture and Biorepository Shared Resources of GUMC. The principal goal was to identify the rates of seroconversion or exposure, in particular the rates of asymptomatic exposure in these two populations. While the study was simple in concept, its execution was actually quite complex, and collaboration between the hospital and the medical center and the expertise of these unique GUMC shared resources was essential to its efficient conduct. So what did we find? Specimens and surveys were collected on 1,034 hospital staff and 417 patients. Antibodies to SARS-CoV-2 were identified in 23 participants, 17 hospital staff, and 6 patients, or 1.6% of the subjects. There was no significant difference in the frequency of antibody positivity between patients and hospital staff. 16 subjects, 10 hospital staff, and 6 patients, or 70% of the subjects with antibodies reported no symptoms. Thus, perhaps surprisingly, cancer patients with a positive antibody result were more likely than hospital staff to have been asymptomatic. There was no significant difference in the rate of antibody positivity based on age, sex, race, ethnicity, comorbidities, NSAID or immunosuppressive use, smoking history, or obesity index. As a comparison, we collected survey and serology results from 509 subjects at Hackensack University Medical Center in New Jersey, an intense COVID hotspot during June and July. The positivity serology rate was 8.3%, 5.3% in cancer patients and 13.1% in hospital staff. So what did we conclude from these findings? The preliminary results were very reassuring, as it suggested that the protective measures put in place by the oncology clinic, the hospital, and the Georgetown and DC communities appeared to have minimized the exposure of hospital staff and patients to the virus during the first wave of the pandemic, and should be able to guide practices as we face future pandemic waves. As next steps, we are in the process of collecting follow-up antibody tests to determine the persistence of seropositivity in the 2 subject groups and the 2 hospital locations. We are also working with Professor Newton Howard's group to test the sensitivity and specificity of their saliva tests for antibodies. And we are considering studying cellular immunity properties in our seropositive subjects, and also considering repeating the testing at a later date to assess whether the protective measures have remained effective. Thank you very much.
Biochemist Mark Danielson has been working on the development of a new COVID-19 test using technology that he and his colleagues developed at Georgetown. Dr. Danielson recently spoke about this work.
The fight against COVID-19 requires detection systems that do not give false results, that are fast and are low cost. Hello, my name is Dr. Mark Danielson. In the past, my research group has devised detection systems for both pathogenic bacteria and RNA viruses. Based on this work, we are developing a fast COVID-19 detection system that has both extremely low false positive rates and also low false negative rates. An exciting development is that we should be able to develop a dipstick type test, since the assay can be used on a solid surface. This test would have specificity at least equal to PCR, but at a lower cost.
In addition to our faculty focused on medical research, we have another extraordinary group of faculty focused on the study and practice of global health. We launched a university-wide global health initiative in 2017, bringing together faculty and students across all of our campuses in advancing global health. Many of our global health faculty have refocused or expanded their work to address issues associated with the global pandemic. John Monahan helps to lead our global health initiative, and he recently spoke about this work and some of our faculty who have focused on COVID-19.
We've really welcomed new faculty to our team. You know, we have Dr. Mark Dybel joined us after leading the Global Fund. Dr. Deus Bezira and a whole group came from the University of Maryland just last year, and they have launched programs in sub-Saharan Africa at Georgetown. We have Jesse Goodman, the former chief scientist at the Food and Drug Administration, Dr. Rebecca Katz, who leads our really path-breaking global health science and security center. All these new faculty have met with some of our, with people we've had here for many years. So it's really a rich community. Dr. Rebecca Katz, who I mentioned earlier, she has put together an amazing array of advice targeted toward local decision makers in the United States and around the world, helping mayors, city council members, business leaders. How do you make tough decisions in the midst of a pandemic? So she's put together an extraordinary set of tools that are really practical things that the people in the real world can use. And we have some of our scientists are working on we have people working on early stage testing and treatment programs in our medical center. We have some terrific modeling going on. Some of our computer modeling experts and data analytics experts are looking at how pandemics like COVID-19 are spreading. How do we track data? So anyway, across Georgetown, there's just a rich mix of faculty experts working and trying to make a difference and helping the world, frankly, address this crisis.
Ambassador Mark Dybel and Dr. Deus Bezira co-lead our Center for Global Health Practice and Impact. Just last month, Ambassador Dybel was named to the independent global panel charged with examining the World Health Organization's response to the COVID-19 pandemic. Our Center for Global Health Practice and Impact has a global team 15 colleagues here in Washington, and more than 600 colleagues in field offices in Haiti, Kenya, Nigeria, Tanzania, Cameroon, and Eswatini. Together, they focus on program implementation, global health security, health innovation and improvement, data science and health technology, and policy, with a particular emphasis on HIV. In recent months, they have used their networks and their expertise to contribute to the COVID-19 response in the countries where they are operating.
Mark Dybel from the Medical Center. We're working on COVID in two important ways. One, in program implementation, we have resources from the Gates Foundation and from the US government to implement large and innovative programs to deliver HIV and tuberculosis services in Africa and Haiti. We've had to integrate COVID into that, both for the healthcare providers, but also for the clients. And we bring local innovation on ideas and solutions to draw people and keep them into services and to use that to drive policy for greater impact. We also work on the policy level. In Africa, we've been supporting the African Union to increase domestic financing for health. They've used those mechanisms to adapt to COVID, including recently a very successful series of meetings between ministers of finance and health to address COVID, understanding that economics and health are one, not in opposition, and you need to deal with both. We also deal with these issues in the United States, driving or hoping to improve how the US deals with the global pandemic. What excites me is the world is coming together. Unfortunately, the US is not in the leadership role it once was. Hopefully that will change soon. But the world is coming together from a research perspective, from communities, from heads of state, to understand that we can only tackle this epidemic if we work together, and to do that for the future, not just for this pandemic.
Finally, I'd like to turn to the work of our Center for Global Health Science and Security, led by Dr. Rebecca Katz. Dr. Katz and her center are focused on a number of projects, including tools to help government leaders and communities make informed and evidence-based decisions about their pandemic response. Nearly 30 students are working on COVID-related research projects at the center.
My name is Rebecca Katz, and I'm a professor at Georgetown, and I direct the Center for Global Health Science and Security. Our entire center, 6 faculty, 7 full-time staff, and approximately 30 part-time researchers and students, work on pandemic preparedness and the policies and practice for how to prevent, detect, and respond to public health emergencies. We are a multidisciplinary center, and the students who have joined our COVID response efforts come from undergraduate and graduate programs, including law, McCourt, NHS, SFS, the college, SCS, and the graduate school. We have numerous research streams related to COVID, but one that we are particularly proud of is a website we launched with our partners from Talis Analytics called covidamp.org, and part of the larger efforts with our partners from NTI and the Center for Global Development, available at covidlocal.org. On the COVID Local site, we have provided a frontline guide for local decision makers and validated metrics for decision making. This tool has been adopted by local leaders around the world, and we're particularly proud of our collaborations with the tribes of Montana. On our COVID AMP site, we provide a robust data set of validated policies around the world related to COVID response, a data visualization platform, and an overlay with our epidemiologic forecasting model. We currently have over 14,000 policies that have been coded, another 400-ish plans, a contact tracing policy tracker, and a legal database that is tracking executive actions and court challenges in the US and around the world. We're conducting analytical work to assess what works, assessing mobility data, epidemiologic outcomes, and K-12 school cases. We've already produced over a dozen research briefs, another 18 peer-reviewed manuscripts, a white paper for the Global Preparedness Monitoring Board on governance, and contributed to multiple reports, including those from the National Academies and the Council of Foreign Relations, and even a children's book on COVID. Mostly, we're focused on creating and expanding the evidence base so we can study what's been done and build stronger systems for the future. We've already begun work on translating our current response tools and research to, fight the next war, bringing together our efforts on climate, conflict, governance, cities, and disease.
I wish to close in gratitude to our researchers for the knowledge they are contributing to this moment. I also wish to recognize the contributions of our students who work alongside our researchers, and our staff who play an important role in supporting our research enterprise. I understand how challenging these past few months have been. Our researchers who had to pause or reimagine their work this past spring, our researchers who are balancing clinical and teaching responsibilities. We are grateful to each one of you for enabling us to fulfill the role that is shared by every university, the responsibility we have to contribute to knowledge and understanding in our world. I look forward to being with you again next week. For every Hoya, everywhere.